Hi, everyone. Good afternoon. My name is Jennifer Rosenfeld, and I'm a nurse practitioner here at Cosmeticare. Today, we're going to be talking about the lunchtime lift, which is basically an overview of PDO Threads. So before we get started, I just want everybody to enter your name in the chat box to be entered in today's raffles. We're going to be doing some giveaways throughout our presentation today. So stay tuned until the end for a special offer available only to our attendees. So if you need to leave early and you're interested in booking a free consultation, please email info@cosmeticare.com, or you can, of course, call the office directly. And again, we'll have that throughout the presentation in case you forget it, but it's info@cosmeticare.com. And lastly, all those who book a consultation today for a future date can receive our special event offers. All right, so let's get started. All right, so today we're going to cover basically just a little bit about why we would choose threads over some of the other traditional methods, where and how we use those threads, who is a candidate, what does the procedure entail, and aftercare. And then, of course, we'll have some before and after sprinkled throughout the presentation. And the fun part is we're going to have a lot of really cool giveaways. All right, so one of the things that we pride ourselves on here is helping people become the best versions of themselves through transformative aesthetic services. Every single provider here is advanced and very talented at their craft. And so no matter who you see here, you're going to get a very crafted, specialized, individual approach to facial rejuvenation. Now, for a lot of you who already know, we are nestled here in Newport Beach. We get a lot of compliments on our views while patients are waiting patiently for us. And then our practice was founded by double board certified plastic surgeon, Dr. Michael Nicoli, who, as many of you know, is sort of the heart of the practice. We are a trusted source for your services for over 35 years, and we're focused on treating the whole you. As some of you may already know or are privy to, we are launching a lot of anti-aging and wellness services throughout the practice, just to sort of help match the beauty that you feel on the outside to feeling good on the inside, which is so important. Okay, so what are PDO threads? Like, what would we ever even use these things for? And they probably sound scary to some of you, but hopefully we will be able to debunk a lot of that today. So threads, they lift tissue, whether it be mid-face or lower face. They contour by sort of creating new collagen vectors. They volumize, and we'll go over that a little more specifically throughout the presentation. And then lastly, the biggest thing, for me at least, is that it stimulates collagen. And the significance of that, we sort of talk about it across the board with everything that we do. Biostimulatory fillers, Sculptra, lasers. Collagen stimulation is the most important component of the rejuvenation process and just sort of keeping everybody looking fresh. So threads, they create a natural lift by laying down collagen, which is going to create a collagen vector. And I'll get into that also a little bit later. But in so doing, by laying down new collagen, we get nice tissue tightening. We also get the collagen stimulation, as we've talked about. So PDO threads are absorbable sutures, if you will. I mean, that's where they kind of originated from. And what happened is surgeons realized that, let's say that you went in for a C-section, and in that place where they laid down those deep dermal sutures to keep you nice and closed up, in its place, collagen was laid down, and also known as a keloid for some patient demographics. So what we discovered is, well, how else can we use those little collagen producing threads in ways that might benefit patients? And PDO threads are the answer to that. Now, when we talk about skin brightening, the next point here, any time that you see somebody that has that luminous skin, that youthful 22-year-old glow, it's because they have tons of collagen and elastin in their skin. It just glows. There's not a lot of breakdown in the tissue yet. And so we're also attempting to sort of restore that when we do PDO threads. We get that natural glow, just as an added bonus, because it's really not the main thing we're getting after when we're doing threads. Threads have minimal downtime. And I say minimal downtime because I'm comparing it to a surgical facelift. So this is more of a non-surgical facelift. And again, that's minimal downtime. It's safe and it's non-invasive. The procedure itself takes me less than 30 minutes to do in the office. You're not put out. It's very comfortable. And so again, safe and non-invasive is sort of the number one deterrent, I feel, for patients that are not, completely on the other side of the fence for getting facelifts. Lastly, we like to maximize results with other treatment modalities. So threads are always, for me, almost always used in conjunction with a different treatment, whether we're doing filler in, let's say, the cheek or the tear troughs or the temples or anywhere for that matter. Not always are we looking to add volume. So let's say I wanted to do a thread to sort of contour my jawline, but I wanted maybe a little bit of filler back here in the lateral part of my cheek. So what I mean by that is threads complement a lot of other procedures that we do here in the office. So people ask me all the time, where can we do threads? So some of the less common areas would be things like the eyebrows. That's sort of trending right now with the fox eye brow lift. But that's sort of significant for patients who come in and say, can you make this brow match this brow? Well, sometimes I can do that with Botox. Sometimes I could do that with filler. And sometimes I can't, because it's not just a muscle component where we can fix it with Botox. It's just sort of genetic, in talking about symmetry. We talk about symmetry when we're doing any kind of a procedure here or an assessment. Me and the other providers here in the MedSpa side, we constantly talk about symmetry and trying to create that. And so let's say somebody has a significant difference in their brow, we can fix that with a thread. Lastly, temples, not lastly, we're still kind of early in the bullet list. So temples are a danger zone for filler, along with a few other areas like tear troughs or even the glabellar lines here. Those are danger zones for filler. And what I mean by danger zones is that the worst thing we ever want to happen when we're injecting filler is for it to get inside of a vessel. And so by doing threads, we're not using anything that's going to sit inside the vessel. We might pierce through it, but we're not actually depositing a thread in an actual vessel. So it's safer. And to minimize our risk as providers, you have to stratify that and know where your vessels are and what can you do and what can't you do. And so temples is a nice area to lay down some threads, stimulate some collagen, and basically minimizing your risk as a provider. It's safe, fast, and it's your own collagen. So a lot of people go for temples with threads. Under eyes, again, this is sort of something that I like to treat with filler or even PRP. So that's really an independent assessment that I would have to have you come in and see if that's what service you would need to correct your under eyes. Now, a big one here is cheek lift. So many of us already know that the entire aging process here, and I love this book, and anybody who is a patient of mine, I've definitely gone through this with them, but this is a mother and a daughter, and they really look so similar. So the daughter gets to basically see how she's going to age if she does nothing. And what she might come in saying is, my mom has this jowl, I'm afraid of getting this jowl, or my mom has tough nasolabial folds and I don't want to get those. So what I can tell you is the aging process does not discriminate. It happens to everybody. The speed at which it happens is dependent on a lot of things: genetics, your lifestyle, and what you do to stimulate collagen and keep yourself looking high and tight. So this little mid-face cheek here, we can lift this and soften the NL fold. This is probably the second biggest concern that I get from women, is this deflated cheek. The first one that I hear from probably every single female that I see that comes into my office is they hate this jowl. They hate this jowl, or they hate this little beginning phase of a marionette. And honestly, this can happen 20s, 30s, 40s, 50s. It all depends on what you do to keep the collagen tight back here in this lateral part of the face. So jawline, jowls, mid-cheek, most common areas that people come in asking me to fix. Now, why would I choose threads over, let's say, filler for this patient? Well, let's say that this patient, you can see over here, she has a beautiful cheekbone. She still has that. If she was flat, I might consider giving her filler because filler fills. It adds volume. Threads lift without so much as adding volume. So this patient would look just like her daughter. Basically, we're going to lift the mid cheek. We would lift back here along the jawline to soften the jowls. And we're going to try to restore as much as we can. As you can see, a younger version of herself would look. Now, that's not the only problem here. So we will eventually sprinkle some filler, some Botox, all that to soften some of the harshness that's happening around the mouth. So when I talk about my relationships with patients, we build a plan. It's not always a one and done. In fact, it's never a one and done appointment. It's sort of a relationship building. We get to know each other. We're working in the right direction. Not everybody wants to sit down and spend $7,000 and get 7 syringes in their face. So threads are a nice alternative to basically surgery and having to do a lot of fillers. So a few more areas, smoker lines, lips. This is super fun because I feel like the trend towards big lips is sort of decreasing. And what people are looking for is just to look like their younger version of their lips. And so we can add some threads into the vermilion border just to take away some of the wrinkling and sharpen that vermilion border so that it looks more defined. Oral commissures, we have a really awesome picture that we'll be showing you towards the end. A quick, again, 5-minute procedure that helps stimulate collagen and lift the corners of the mouth. Marionettes and gels, we already talked about that. And then in terms of the chin area, that's the second thing women say. I hate my gels, I hate my marionettes, and then what can you do about my chin? Well, we have some options here. And for some women who just have some elasticity here, where there's some loose skin, we can do some threads underneath the chin to create a vector and keep it nice and tight. All right, guys, so that was a lot of information. It's a perfect time to do a giveaway. And the first one we're gonna be doing is a skincare product bundle, and its value is $150. And what I love is that it has basically everything that every single person can benefit from. We have a nice, wonderful cleanser, purifying cleanser. It's gonna get nice and sudsy, which I love. I want all my makeup off my face when I go to bed, not like one sprinkling of a mascara left. So this is definitely gonna help you achieve that. Second thing is we have some glycolic pads. I just can't explain to people more how important glycolic is if you can tolerate it. And I say tolerate it because some patients that have rosacea, in fact, I get it on my forehead. I can't use my glycolic pads there, but I use it everywhere else. Glycolic is a chemical exfoliant. It's gonna keep you looking nice and fresh, get all the dead skin off. One pad, use it till it's dry on your whole entire face, your neck, your chest. You will thank me later. And then, of course, we cannot have anything without a retinol because I mean, without SPF and retinol, skincare is like all lotion. None of it is that impactful. So we've got a retinol back here behind, which is going to cause cellular turnover and keep you looking young. And then lastly, we have an oil-free sunscreen. And of course, doesn't matter rain or shine, SPF every day. It's a great habit to get into, and it'll keep your collagen, at least there as it should be, instead of the sun degrading it and causing some oxidative stress. So let's go ahead and take a look here. I'm going to draw a name out. Let's see. Tiffany Haroby, you are our winner. Congratulations. So please email info@cosmeticare.com. Provide your phone number to claim your prize. And of course, if you need any instructions on how to use all this stuff, I'd be happy to pop out and talk to you about it. All right, so let's move on. Okay, so who's a candidate for threads? Basically, people that don't want a facelift, that have, well, and I say this, we should use this carefully, because when I tell you that I can give you a lift with threads, we want to be specific. I cannot give you a surgical facelift result. So if you have a significant amount of sagging skin, you know, stuff that really needs to be lifted, again, like I said, I don't like to recommend services that don't deliver. And so if I can't deliver the results you're looking for, I'm most definitely going to refer you to one of our wonderful surgeons here in the practice. They all do beautiful work and you're in good hands. So what I can't do, somebody can do. But again, people that are looking to avoid surgery or that are looking for, let's say, a smaller lift in the face, those patients are for me. Patients looking for tightness and texture improvement, patients with mild to moderate jowling and marionettes that need a 1 to 3 millimeter lift. You know, even on its best day, I cannot give you like this huge inch off of your face with threads. It just wouldn't look right, and it wouldn't last. So patients in good health without autoimmune disorders, I'm sorry, ladies, if you have any like hypothyroidism, lupus, things like that, you're just not in a position to gamble with your health. And, you know, we don't necessarily know how your body's going to react to the threads. So we're just going to bypass it. But I have other answers for you. Patients with reasonable expectations. I say this because, and I literally will talk to you about 3 to 5 times in the consult about, do you understand what I can give you? Because expectations are everything in this industry. If I can level set them with you, you know what to expect. I know what to deliver. Both of us are going to be happy at the end of the day. And then, of course, no allergies. No allergies to the absorbable polydioxanone threads. Okay, so we're going to watch a little video, and there's some music in the background, but basically I'll just walk you through briefly what we're going to do. So initially we clean the face completely, and we use Hibiclens, which is a soapy substance used in surgery that's going to kill bacteria, and it keeps you nice and clean for longer than after you leave. So we clean the skin. The next thing I do is I numb you with just a little tiny local lidocaine bleb back here in the face. You hardly even feel it. I've got a really gentle hand. Then we let you sit for a few minutes just to make sure that that's all kicked in. And then we get to work, and we're going to lay down. I'm going to draw on your face where we get the most lift, right? We want to place them correctly. And then we insert the threads, and then we pull the cannula out. This is probably a great opportunity for me to show you what one of these guys looks like. So this is a PDO thread. And of course, this is the casing. So I'll just take this out. Now, this metal cannula is blunt tipped on the end. I don't know if you can see that, but it's not sharp. And what that means for you is that it's not like busting through the tissue and causing lots of injury or breaking through vessels. It's just a mechanism. This is just a vessel for the thread to get placed into your tissue. So this little tiny blue thread, I don't know if you can see that, it's super tiny. That's what's left in the tissue. And what it does is it anchors into the dermis. And then from there, when I pull this out, we do some massaging, and the barbs, which is where this comes from, the name of the actual thread, they latch onto the tissue. And then over time, this thread dissolves, and we'll talk about that on the next slide. And what's laid down is your collagen vector. So after that, we get you all clipped. We take off the rest of the thread that is not needed for the skin, and then you're in and out. It's a very easy, fast, painless procedure. So I'm going to go ahead and show you guys what this looks like. Easy. So one of the things I want to point out is that that lady, she's beautiful when she comes in. And this is the like late 30s where we start to just sort of notice a little weight here. And we want to catch it before it gets bad. She's the ideal candidate. Her expectations were level set. In fact, I was like, no, you don't need it. You don't need it. You don't need anything. And she realizes that the aging process isn't going to stop. And so, you know, she's getting ahead of it. So I love that about that patient. All right. Okay, so post-care. How does this, what does it feel like for you? You have a little tenderness, nothing more than you would have if we did filler. Just a little tiny mild tightness patients report. I want you to keep the area clean, and you'll leave with a little tiny round circular Band-Aid over the area that we inserted the threads, just to make sure that you don't contaminate or anything like that. No shampoo or active skincare. Active skincare meaning retinols, vitamin C's, anything with enzymes in them. We just kind of want your skin to just have a little bit of a break for 24 hours. No makeup. I know this is a difficult one, but I mean, I'll just tell you the truth. You could do your threads, or you could do your brows, you could do your mascara, but I don't want any face makeup on. You can give it a break for a day or two. It's worth the results. And then no touching. People always ask, should I massage after? The answer is no, don't touch it, leave it alone. And then no pressure or facial massages for 2 weeks. I just don't want anything moving around. You know, we chew throughout the day. That's enough interaction that I want with those threads. No exercise for 48 to 72 hours. The reason for this is I don't like sweat and bacteria and all that kind of stuff coming anywhere near those insertion sites. And then no dental procedures for 1 month. You know, with filler, it's 2 weeks before and after. But, you know, opening your mouth is going to sort of, you know, loosen up those threads. And what are we doing at the dentist? We've got our mouth open for most of the time. So we just ask that you wait for a month until you decide to do that. Okay, guys, it's our second giveaway. So this one I'm the most excited about. So we are actually giving away a free syringe of Radius. This is a monster value. It's $850 off. Now, some of you might be thinking, I don't know if I need filler. Well, the nice thing about Radius is that this is a biostimulatory filler, and I can either take it from its original form and use it. It, by the way, has the highest G prime in all of the filler, you know, community. So we get some serious lift. We can use it for cheeks. We can use it for jawlines. Or I can dilute it and really spread around these wonderful little collagen stimulating molecules and create a pan facial rejuvenation, whether it's for volume loss on the face. I can use it in the neck, which I've got an awesome before and after that I'm going to show you. I can use it in the hands to help get rid of the wrinkling or like the tendons and the veins that show. I'm like a prime candidate. Allison, I'm coming for you. And so there's a lot of things that we can do with this product. And what I mean by biostimulatory is that this product, once it's laid down into the tissue, stimulates your body to make collagen. It's such a wonderful product. It's probably something that I go to very often, if you know me, and I love it. So let's just see who we got and who's getting lucky today. Brenda Cole. I am so excited about this one for you. So basically, you'll email info@cosmeticare.com to go ahead and claim that. Leave us your phone number so we can reach out to you. This is like just so monstrous. So I'm super excited for you. Let's move on. By the way, this is a before and after of the neck that I treated with Radius, which is the product that we just gave away. I cannot even tell you how enthusiastic I am about this picture because along with jowling and marionettes, women hate their necks. In fact, Nora Ephron wrote a book about it. And so I'll just tell you, I mean, I'm wearing my trusted turtleneck today, but you know, this is a really hard to treat area. It doesn't have the same appendages that we have in the face. And so creating collagen and changing the skin on a neck is very challenging. And Radius does that. So as you can see in this before picture, she's got a lot of crepiness going on, all the little lines. This is after one treatment. And we did a second one that day because she's like, well, let's just keep going. You know, if now her neck looks like a 40-year-old, maybe we can get it down to a 30-year-old. So That's radius, and it's magic. Okay, so how long do threads last? That's another question. So it takes about 0 to 9 months for the thread to completely break down. After about a week and a half, you will completely have forgotten that you even had this in your face. You know, initially I think people focus, they're hyper-focused when we do filler. But when we do these initially, you might be thinking you have them in your face. But after about a week, you will completely forget. However, it takes 0 to 9 months for that product to completely break down. I don't know, 6 to 9 months, forgive me. And basically, we get about a year to a year and a half years, I cannot speak today, of collagen. And what we're basically fighting against is just the normal aging process. And so, unfortunately, I can stimulate your collagen. But every day that passes, it's just sort of breaking down. Let's see, 6 weeks is when patients are going to start to see the additional improvement. So when we first do the procedure, you get that mechanical traction. We get this nice lift right away. But the benefits haven't even kicked in yet. So around 6 weeks, the collagen starts to take place and we get additional lifting, we get more luminosity. And this is sort of like when, if you've got something coming up, come see me 6 weeks before. This is a perfect timing for you. Okay, so follow-up appointments happen at 6 weeks to see if we need to place additional threads and just to see your progress. So down here in this lower picture here, you can see, and I'll show you the before and afters on the next slide. This patient I was treating, these are the smooth threads. So they're literally like a third of the size of this thread. They're really tiny. The patients don't feel them. It takes 5 minutes to put them in. And again, we're lifting the tissue and stimulating collagen. So here in this picture, what I want you to kind of focus on, because people sometimes gravitate to other areas, is that we really lifted the oral commissures, the corner of her mouth. This is 5 minutes. We were able to do this without adding volume. So if I chose, let's say, filler in this area, you can get sort of like this little sausage that happens over here with poor placement. I've seen it tons of times. But this allows us to basically lift the corners of the mouth without adding volume. And I love it. So that's one thing we did on her. The next thing we did is we used smooth threads in the actual vermilion border of her lip. So you can see that she has more luminosity. I love how this is light reflected here on this corner of the mouth. And it's hard to tell in this picture, but there's just this little shallow wrinkling that's happening in front of the vermilion border. And over here, there's not. So this is one of those ways that we can treat small areas of the face with PDO threads. Now, this is an example of barbed threads. So the big daddies, the ones that do all the heavy duty lifting. And what I want you to see here is this little jowl. It's subtle. The patient is very good about her skincare. She is constantly trying to fight the aging process. Love her to death, but this is just a natural part of aging. So we did some threads along her jawline only, and we erased her jowl. So this is what you can kind of expect when we say 1 to 3 millimeter lift. That's what that is. I cannot give you a facelift with threads, but I can stave off getting a facelift. Okay, so the virtual event offer that we have right now is, of course, a free consultation with me. And we will discuss everything. And if you're not a candidate for threads, I will also let you know what I think you might be a candidate for. It's really an invaluable appointment because I go through everything. And if there's something that I can't do, maybe it's something that Tanaz in our office can do. Maybe it's a laser that you need. Maybe it's a facial, however, whatever it is, we'll figure it out at your consultation. Now, the next thing that's an offer only for patients that are signed on today is $250 off of a thread procedure. And that's huge. And then, of course, this one, I even question it, but 50% off 1 syringe of radius. This guy is huge, you guys. I can use this in knees, elbows. I can use this on the inner part of the arm where people don't like that texture, kind of looks like cellulite on their arms. I can use this anywhere. So this one is pretty big. All right, you guys. So here's that email again. If you're interested in setting up a consultation, we have info@cosmeticare.com. Here's the phone number you can call to reach somebody. And then let's see, we've got one more giveaway. So this one is for one free thread treatment for one small area. So maybe it's temples, maybe it's marionettes, maybe it's lips, maybe it's underneath the chin. This one is super awesome because it's so fast. We just lay down 5 or so small threads, and that creates a nice collagen vector that sort of tightens up the chin. So if you have some of that loose skin that's happening here, not fat, but like the loose skin, we can fix that. So let's see who is our lucky winner. Lisa Sanders, how exciting. Congratulations. So again, please email info@cosmeticare.com and give us your phone number so we can reach out to you and get you scheduled for one of our procedures. And guys, I just want to mention too that with those small little areas that we're talking about, we numb you with numbing cream. You're not like just going straight in, and we're not, you know, being seamstresses here. This is really the whole point of the office, is to make this an enjoyable experience for you. And so we make sure that your comfort is included in that. All right, you guys, thank you for joining us. Now, let's see. I think I have a few questions. How long does the treatment take? So if we were doing mid and lower face, that's about a 30 to 45 minute appointment. And then if we're doing, let's say, jawline, we're still looking at about 30 minutes. Any of those small areas, necklines, under the chin, around the mouth, those are really more like 15-minute appointments. And of course, you'll numb for 15 minutes on top of that. So total appointment time with me would be 15 minutes. Now, do threads work for me if I've already had a facelift? So that depends. 2 things happen when you have a facelift. The whole entire landscape shifts. And so for patients, let's say, that have had a rhinoplasty, you know, the vessels under the skin that might have been here could now be here. So there's a few variables that go into that, but there is absolutely a possibility that we can do some corrective work with threads. Even if you've had a facelift, we can always lay down threads down in this area for like textural improvement. Because even though facelifts correct the sagging skin, they don't correct the texture. So that is something that we can also treat with threads. And last thing I realized was not included is that these small threads work fabulous on acne scars. So for patients who have acne in this part of the cheek, you know, of course, we have microneedling and RF procedures, but these little threads work excellent. So if that's something that is bothering you, we can also treat those with PDO threads. Okay, will it work for my husband too? Another component to the consultation is determining the integrity of your skin. And so if patients have thick, heavy, weighted skin, it's going to be very challenging for me to lift with threads, right? I mean, these are not miracle workers. They do a lot of nice things, but I can't lift, you know, entire, let's say, I don't know, 20-ounce pieces of meat. It's not going to happen. So if you have really heavy skin, this is probably not for you, but again, we'll determine that during our consultation. And then the other side of that would be patients that just don't have enough dermis to actually cover the thread or even create that nice, you know, texture. And then, sorry, ladies, but if you're at a place in your life where you're no longer even making collagen, I say 75 and up, it's going to be difficult. I can create that mechanical traction, but I'm not really going to lay down as much collagen as I would in somebody that's younger. But this is really truly for like our 35 to 65-year-old patients. All right, so what is the downtime? I'll say that for about 24 hours, you might be feeling a little tender just from the insertion, but that dissolves after about 24 hours. You're free to take some Advil. I don't feel like people do. The procedure is very comfortable. I make sure of it. But let's just say that for 1 week, I'd prefer that you weren't eating Big Macs or apples, things that were going to cause you to open your mouth really wide. Other than that, I think you're free. Okay, you guys, so all questions and all of those concerns can be addressed in our consultation. I want to just let you guys know that I'm booked about 3 weeks out right now. The holidays are coming, and in our industry, I'd say late October all the way to January 1, it's a very busy time. Everybody wanting to get holiday ready, look their best in front of friends, colleagues, and family. So please, if you're interested, try to get on my books soon. That way we can get you ready for the holidays. All right, everybody. Thank you. Have a great day.